everybody, welcome back to Sky Girl Reporter, and today we're at a doctor's office and we are going to be interviewing a doctor named Dr. Crocker. So let's get started. My first question is, how does a person become a doctor?
That's a great question, Sky Girl Reporter. So you have to graduate high school, and then you have to go to a college, a 4-year college, and you have to get a degree, any degree. It doesn't have to be in science. And then you go to medical school, and that's another 4 years in medical school. And then you graduate medical school, and after medical school, you pick a specialty of what kind of doctor you want to be. And then you do a residency in your specialty. So at least after high school, you have to do 4 years of college, 4 years of medical school, and then 3 to 7 years of residency before you're on your own as a doctor.
What types of doctors are there?
Great question. There's pediatric doctors, there's adult doctors, there's doctors who do surgery, there's doctors that look into your eyes, and those are called ophthalmologists. There's doctors that work on your bones, those are called orthopedic surgeon doctors. There's so many doctors. I probably didn't even cover half of the types of doctors. Is that enough?
Yeah.
Okay.
What is your specialty?
My specialty is family medicine. That's a great question. So what does family medicine mean? Family medicine means that you can take care of patients from birth to being an older adult. Maybe you could deliver babies, you could do minor procedures. Family medicine is a specialty that came out of the need for doctors in more rural areas to be able to see the whole community and take care of a lot of needs.
Why did you choose that specialty?
I chose family medicine because I like taking care of all people. In medical school, I loved my rotations with kids, I loved my rotations with adults, I loved doing deliveries, and to be honest, I just couldn't think of not seeing kids or adults, so I wanted to have a practice where I got to see all ages. And I think it's really cool that some families can go to one doctor for the entire family rather than having different doctors.
What kind of problems do people have when they come to you?
That's an excellent question. All sorts of problems. So sometimes people come for what I call something acute, meaning new. So let's say that they were at the beach the day before and they were running and they twisted their ankle and now their ankle hurts. So it's something new that they want to talk to the doctor about. I'm usually people's first stop. Sometimes I would get an x-ray, other times maybe just tell them to rest and use ice. Other times I see people for things that they've had for a long time. So there's a condition called diabetes where some people get diagnosed many years ago and it's something that they have and they need to come back and see me every couple months to make sure things are going well and they have the right medications. So that's a hard question. Family medicine, we pretty much see everything.
What do you check when you examine patients?
That's a great question. They come for their physical exam. We really look head to toe and make sure that everything is appropriate for their age. So we look at their head, make sure they don't have any bumps. We look at their skin, make sure they don't have any moles that look different. We listen to their heart to make sure their heart sounds normal. We listen to their lungs to make sure that they're breathing air in and out easily. We listen to their stomach to make sure that it's working right. And then we also use our hands. We feel their stomach to make sure it feels soft. We test their muscle strength against our resistance with our hands to make sure they're strong and everything's the same on both sides. So if anything of what I just said is maybe not what we would expect, then we would dive deeper and ask questions about what's going on to make sure our patients are healthy.
What type of tests do you use on patients?
some of our tests are physical exam tests where we have them do certain things. Let's say they're having a sore arm or a sore shoulder. We have them do certain tests and try to pick things up or try to keep their arms in certain positions to identify maybe which muscle is hurting them. Then we also have tests that we call laboratory tests, which sometimes they have to get their blood drawn or they have to give a sample of maybe their urine if we're concerned that they have an infection or something going on. And then there's also tests that we call imaging, which there's x-rays, CT scans, MRIs. These are all fancy ways to see under the skin if we have any concerns.
What can you learn from a blood test?
We can learn so much. It really just depends what we're asking the lab to look at. So I would say most simply our blood tests count the number of blood cells that you have in your body, because your blood is important for bringing oxygen to your brain, to your heart, to your muscles, so you can do everything that you need. And so if you have low numbers of blood cells, maybe it's harder for you to exercise because your body doesn't get as much oxygen.
Why did you want to be a doctor?
That's such a good question, and I have such a simple answer. It's because I wanted to help people. I really just enjoy interacting with patients, getting to know them, and maybe making their days a little bit easier, or maybe making them understand what's happening to them a little simpler so they can learn how to live their life to their fullest desires regardless of what's going on with them in their health.
I have a new question that I thought of. What was the hardest part during the pandemic?
The pandemic was very hard, and unfortunately is still very hard because we're not out of it. One of the hardest parts of the pandemic for me, to be honest, is when patients come and see me who haven't gotten their vaccine and they're old enough to get their vaccine, and even after me talking to them, they still don't want to get it. Because that's hard, because I feel like the vaccine is very helpful and it's going to be what kind of moves us as a country out of the pandemic. So it hurts a little bit when patients don't want to get their vaccine.
What do you love about being a doctor?
I love being a doctor because my days are so exciting. I see a ton of patients every day, and sometimes it says why they're coming in, and then we end up talking about something totally different. Everybody is unique, and it keeps me thinking. I always have to read new things. I always have to keep learning because my patients teach me so much. And every day, every patient is something new, and it's very exciting and challenging, but I think that's a good thing.
What is the hardest part about being a doctor?
That's a good question. The hardest part, I think, is kind of what I said with the last question, that everybody's so different and I'm learning so much and I have so much to read that doing everything in 24 hours is sometimes hard, and then leaving enough time for me to take care of myself. We have to see the patients and write our notes and make sure they have all their medications, and then sometimes I don't know the answer when the patient comes to see me, and I have to do some reading and make sure I understand what's going on. So I think it's just fitting everything into the day, but I like the challenge and I'm very happy to be doing it.
What qualities should a doctor have?
Another great question. I think qualities a doctor should have is curiosity. We have a lot of patients come to us, and sometimes maybe it feels that we've seen this before, but I think it's always good to be very curious and make sure and remember that every person is unique and they can have a lot of different issues that look like something we've seen before, but it could be different. So being very curious, asking good questions, and then being a good listener, listening to what the patients are saying and what we can do to help them.
Is there anything else people should know about being a doctor?
I think some people think that being a doctor is something that's too hard. It takes too much school, too much time. But I think it's a very worthwhile career, and I think that it's not as hard to be a doctor as maybe some younger kids in high school or college think. That I think if you talk to academic advisors in college and you talk to your professors, that people can help you along the way. And I think it's a really rewarding career, and I think more young people should think about becoming a doctor.
So that was my last question, and I would like to say thank you to
Dr. Crocker.
Dr. Crocker. I learned a lot about being a doctor, and it was a pleasure. So I would like to say thank you. Thank you.
You're welcome. It was so much fun. It was my pleasure.
So now we're inside the building, and Dr. Crocker is going to show us some of her equipment.
So this is a stethoscope, and I can listen to heart sounds, lung sounds, and their belly to make sure everything is working normal. So with the heart, I just have the patient sit and breathe normally. And I move the stethoscope to 4 different places because the heart has 4 different heart valves, and I want to listen to each one of them. With the lungs, I listen also in multiple places on the back because you have different lobes of your lungs, and you want to make sure all the lobes are working well. So take a deep breath in and out through your mouth. And I'll move it around with each breath. And now I'll listen over your stomach. I can hear your stomach digesting your lunch. Did you have a sandwich?
No.
Ah, guessed wrong. Okay, so that's the stethoscope. Now I'll show you the otoscope. This is what I use to look in patients' ears. So this has a light, and I grab a special cone, and then I can look in your ear and make sure I can see your eardrum, which helps you hear. Looks totally normal. And I would make sure to look on both sides. And this is what I call an ophthalmoscope, which I won't use today just because we have the lights on and you typically need the lights off. But I can look into the back of your eye and make sure all the blood vessels and the back of your eye look normal. So those are the usual tools I use during a physical exam.
That's cool.
Thanks for coming to the doctor today.
Thank you.
It was so
Dr.
nice
Crocker.
to meet you. This was really fun. See you soon.
So I hope to see you next time on Sky Girl Reporter with a new person telling us what their job is, and hopefully you learned a lot in this video. So thank you. Bye.